Assalamualaikum warahmatullahi wabarakatuh. My name is Ikhmal Farhael. My metric number is 2014837. So today our group will present this particular topic, which is very crucial these days, which is managing the spread of Covid-19 based on Islamic perspective. So I will give a general overview about our presentations. So initially, as everyone perceives, Covid-19 has caused many deaths and also worsens individual health. For instance, those who experience diabetes, they are considered as a high-risky individual. It may lead to death in certain conditions. Other than that, this pandemic also consequences the major problems in every country, I reckon. For instance, in terms of economic, politics, and also social. I will give an example from the economic aspect, which are literature review from Han Jafur, which cited by Judith in 2022. The virus has led to both demand and supply disruptions, which have been exacerbated by interconnectedness of the world economy. This means that the economy in terms of the producer or the consumer itself, they are being disrupted due to the close border among the countries, which cannot the export and import activity to be held. By that, we have come up with point of views or recommendation to manage COVID-19 based on Islamic perspective. Firstly, by imposing the Movement Control Order (MCO) and encouraging people to get vaccinated or healthcare, adhering to the standard operation procedures, and also providing the health Wahab. These views will be disclosed by the rest of presenters, and it is in Islamic perspective way.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammd Hafiz and I will be presenting on the Movement Control Order. MCO is a number of non-pharmaceutical interventions, usually known as lockdowns, which encompass stay-at-home orders, curfews, quarantines, cordon sanitaires, and similar societal restrictions that have been implemented in numerous countries and territories around the world. Malaysia has gone through many types of lockdowns. Among them are MCO, CMCO, RMCO, EMCO, TEMCO, and AEMCO. All the types of lockdowns imposed by the Malaysian governments are meant for the well-being of its citizens. But why don't the governments just impose a total lockdown? Let's take an example of Bangladesh. According to an AA.com report, Bangladesh imposed a nationwide shutdown on Tuesday, equal to March 24, 2020, to curb the spread of novel coronavirus following 4 deaths and at least 39 infections. Its authorities declare a ban on passenger travels by water, rail, and domestic air routes from March 24th, while all public transport on the roads will suspended from March 26th to curb the spread of the virus, officially known as Covid-19. As a result, hundreds of its low-income citizens in the capital Dhaka left the city in various ways amid a high risk of Covid-19 infections, including occupying the roof of public buses and trucks at the Motij Hill business hub in Dhaka in violations of government's directives. From here, it can be said that the Malaysian government considered all the aspects of mutual needs before imposing total lockdowns by taking into account all economic, social, and political factors. Next, in ensuring the effectiveness of the measures taken, some of the things that may be done to manage the spread of the pandemics are to overcome fake news and transparent and rigorous approach to legislations and law enforcement by the governments. Fake news is a dangerous issue that needs to be tackled if the Malaysian government wants all lockdowns imposed to be effective to curb the virus. One of the solutions is that the Malaysian government provide reliable and credible informational discourse on COVID-19 and the outbreak assistance provided by the Malaysian government where it is essential to mitigate the spread of COVID-19. In Islam, actual knowledge and potential knowledge affect the sensitivity of a person's mukallaf to the responsibilities he bears. In the context of a movement control order, the presence of a person in the MCO area already qualifies a person to have an obligation to comply with the laws imposed on the area, while a person's positions to identify the law that are imposed either directly or indirectly is the potential law. For the second recommendation is that transparent and rigorous approach to legislations and law enforcement by the government. Constraints of the movements against the community and inequality of law enforcement of movement control orders against the community cause confusion to the people. Thus, a transparent and rigorous approach to legislation and law enforcement must be taken by the governments to ensure the smooth process and effectiveness of such movements control orders or any precautionary measures to ensure a good levels of effectiveness in combating the spread of coronavirus. Also, there should not be any double standard element in law enforcement among the community, as it will provoke chaos and unwillingness of the peoples to comply with the SOPs that have been set. Okay, I think that's all for me. Thank you.
Assalamualaikum to Dr. Ahmad Al Muhammadi and all my fellow friends. My name Muhammd Hafizuddin bin Abdul Rahim, metric number 2018253. Today I would like to talk how managing the spread of COVID-19 pandemic by the vaccination. The vaccine reduces symptoms and cause death causing COVID-19 infection, but recent evidence suggests it can reduce the risk of transmitting the infection virus to others. In addition, the vaccination is to achieve group immunity, which means that the virus cannot enter a group of people and have the strength, defense, and military memory to fight the real virus, which is stronger. Therefore, it prevents the transmission of the virus from one another, as the vaccine has protected the body to easily get COVID. On the other hand, the vaccination process can produce antibody will remain in the body even after the individual is free or recover from infection. Each antibody is specific to each bacteria or virus. In addition, hadith narrated by Muslim, it is obligatory for every sane believer to believe that every disease revealed by Allah Subhanahu Wa Taala will surely be given its cure one for all. The Prophet SAW said, every disease has a cure. When the cure is accordant with a disease, it will be assured by a cure with the permission of Allah Subhanahu Wa Taala. Thank you.
We move on to the next topic, which is SOPs. SOPs stand for Standard Operation Procedure, which is one of my subtopic, which is social distancing. So practicing the social distancing here became an effective way to control the transmission, which is COVID-19 virus is spread through the liquid droplets and droplets produced from the saliva when talking or coaching, rather than carrying airborne. So many health experts say that the water droplets is quite heavy in nature and will not fly for a distance of more than 1 meter. So this is why we practicing the social distancing at least 1 meter from another person. So by insisting the social distancing, it will indicate the gap of conversation between one and another, and therefore it could prevent the droplets to infect the individuals or person. So anything that we think can be harm others and can give a big cause, especially in terms of health, is prohibited in Islam. Allah say in the Surah Al-A'laf verse 56, which is, and cause not corruption upon the earth after its reformation, and invoke him in fear and aspiration. Indeed, the mercy of Allah near to the doors of good. So this is why we should implement the social distancing, especially for us to stop the spreading of COVID-19. Next subtopic is wearing mask. So wearing mask will help prevent the fluids from the nose and mouth from spreading into the air, especially when one coughing, sneezing, or talking. So this is why using mask will help to prevent the COVID-19 from spreading. So the third one is prepare self-care or hygiene. The practices include bathing, washing hands with soap, use of hand sanitizer, and more. Hand sanitizer should have an alcohol content of at least 60% to 80% to trigger rapid or optimal antimicrobial action. So the use of hand sanitizer is usually faster and more effective and easier to do so, as well being hypoallergenic or non-allergenic, odorless and colorless. So Islam obliges its people to practice cleanliness at all times, especially personal hygiene. So the cleanliness is a part of religion, as it's mentioned in the hadith of Prophet Muhammad sallallahu alaihi wasallam in Al-Tirmidhi, which is cleanliness is part of Iman. So I think that's all from me, and I will pass to the next.
Next is Wahab. COVID-19 is a difficult and expensive virus to combat. Many measures are required to battle the COVID-19 pandemic, with part of that going towards improving the health facilities. One of things that may be done to combat this pandemic is to increase the presence of the Wahab, which is supported by all parts of society, can act as both a shield and weapon against the virus. From the point of view of the use of this Wahab, Al-Waqaf Al-Mubasir played a big role in combating the pandemic that is now plaguing the world. Al-Waqaf Al-Mubasir refers to providing service directly to the receiver of the Waqaf. Waqaf conditions are as follows. First, has a price value on the Islamic side. Second, belong the perfect by the person who give the Waqaf. Third, know to exist for sure. Fourth, the property must be something that can be taken advantage of. Fifth, endowed from good purpose only and does not violate Islamic law. There are three types of the Hal Waqaf. First, cash Waqaf. Cash Waqaf used to build or restore the hospital, and also for development or restoration of an existing hospital may be accomplished quickly. Second, Hal Equipment Waqaf. There is a lot of equipment needed in dealing with the COVID-19. For example, disposable equipment like masks, personal protective equipment, and also the nasal swab. Next one is the reusable equipment like ventilator, thermometer, and also the special ambulance. Third, water resource provision. Perceive the availability of the water resource for the hand washing and other essential. Some members of the community who may have the trouble access clean water during the COVID-19 outbreak. Next is Islamic perspective that related with the Al-Waqaf. In the Surah Al-Baqarah verse 195 as follows, and spend your wealth in the way of the Allah, and do not you drop yourself into the run, and do well, for verily Allah loves those who do good.
To conclude our presentations, as everyone knows that handling COVID-19 is not an easy task. Even the governments, the higher authorities, they are sick for a very great solution to ensure their peoples are living and the country itself are in the economical good condition. This makes government or the related parties to do extra works. I mean, like they are require many experimentals, and also they need a wide pearls of wisdom to make sure this pandemic being handled with a lens of the Islamic perspective particularly. So this pandemic also taught us a very essential values to always be patient. In the Quran says that do not dispute and thus lose courage, and then your strength will depart, and be patient. Indeed, Allah is with the as-sabiron, those who keep patient, in Quran ayat 8:46. That's all from us. Thank you.